after the tooth is extracted, depending on how much bone is left, a good diagnostics has to be done. The remaining bone thickness and morphology has to be determined, preferably by a 3D imaging, like a cone beam CT in dentistry, or a traditional CT, which is not used so often nowadays because of radiation. From there, we can work on ways and means to regenerate new tissues to replicate what the patient used to look like, or at least go nearer there from its pre-existing sunken state. We would look into various means and sources. A few sources I can think of would be the human himself, the body, places like the other areas of the jaw, like the chin, the retromolar area, the calvarium, and of course the hip bone, which is quite routinely used by some surgeons. And this is by far the gold standard because it comes with very little allergic reactions. But the disadvantage is of its morbidity, because the patient has to go through a surgery, which is quite painful, and blood loss. And in terms of calvarium and hip surgeries, you will need a hospital stay sometimes, over maybe a week. Walking may be a problem if you go for a hip graft, unless, of course, the patient thinks that it is worth it to go through this, maybe due to extensive bone requirement. The hip graft is needed. I would not suggest this on a routine basis. Other sources would include things like